Hello, everyone, and welcome to Holding the Line, Defending Equity in Healthcare, the Patient Advocate Foundation's Fall 2025 Innovation Summit. I'm Gwen Darien, and I lead patient advocacy, engagement, and education at the Patient Advocate Foundation. I am also a longtime advocate, almost 30 years, and a longtime cancer survivor. And I got into advocacy I began advocacy after my first diagnosis of cancer. I've had cancer multiple times. And there were a number of things that were foundational values. And I just want to give a little context for what we're talking about today, which have never changed, but how we talk about them has changed a lot and have never changed for me. One of them was the absolute commitment to equitable access to quality, affordable healthcare for everyone, inclusion of many people who make up the for me, I started out in cancer, but for many of the people who make up all of the healthcare ecosystem, and to ensure that their voices were not only that I didn't speak for those voices, but that I helped make sure that those voices were heard by bringing those voices to the table. And I say this, I have said this on a number of occasions, but I remember when I first started doing advocacy, all we wanted was a seat at the table. And we made a lot of compromises to have a seat at the table, patient advocates. But over the years, it certainly has evolved to wanting to be part of building the table, and often now to be the ones who are building the table and inviting other people to join. And one of our speakers in an earlier summit said, we have to understand, she was a researcher who did a lot of work with the Alaska Native community. We have to understand that we're here by invitation only, and we can always be asked to leave. And so we decided, our team, the Patient Advocacy Engagement and Education team, has been committed to having to health equity as a foundational value through all of the work that we've done. I've been at PAF almost 10 years, and many of my colleagues have been here almost as long, and a few of them longer than me. And we have, if I think about and go back to the things that we've done, there really has been a through line, and everything we do builds on what we've learned before. And then this year, I think we were all hit in January with a significant threat to the work that not just that we did, but the people that we serve and the people that we love. And so we decided that in the last two innovation summits, we really wanted to speak about what it meant to defend equity in healthcare. Some of our earlier foundational work that helped us come to this point was we did a consortium on identity in the healthcare experience. You will hear two excerpts from that. Podcast series. We talked about learning from communities, not about communities. We talked about achieving health justice together. And then our spring Innovation Summit was Hear Me Now, Storytelling in Uncertain Times. Because one of the things that we are really, really concerned about, and I know most of you are joining are really concerned about, if not all of you, is the silencing of the voices that we had worked so hard, and the communities that we had worked so hard at centering in these conversations. So I think one of the themes that we'll see throughout this day is this notion of what happens when voices, communities are decentered. And what happens how do we preserve equity and center equity in historically marginalized communities when we can't even use words like equity, and they are words that get us that often put many people under threat, the words that they use. And you'll see throughout today that there are many, many bold and direct and multifaceted conversations that will be taking place throughout this agenda. We also wanted to talk a little bit about courage and what are the different ways of approaching courage in the face of threats to everything that we value and believe in. And so there will be multiple facets of how we think about courage. We also one of my favorite books and one of my favorite quotes, and we will be talking about that as well throughout the day, is Heather McGhee's book, The Sum of Us. And we're going to talk a lot about the zero sum and the zero sum game that has been entering so much into our experience as health advocates, health activists, health patients, healthcare providers, healthcare researchers, which is, and her quote is, uprooting the zero sum is so essential, as is embedding in its place the knowledge that we truly do need each other. Solidarity is the answer. The sum of us can accomplish far more than just some of us. And today you will also hear the power of the individual as well as the power of we. And there is a continuum, and we all can do something. Sometimes in the face of hopelessness, we think there's nothing that we can do, but everything we do makes a difference, and everything that we can do makes a difference, whether it's individually or whether and that adds up to part of the we. I also think, and as I was looking at thinking about Abigail Echohawk's presentation, is the evolution that we made from the beginning of health equity, when I was, and all of the amazing people that I worked with, where we talked about equality. We didn't talk about equity. And then we got to the point where we really were able to use the words and think about the words as equity, not equality, because equality doesn't always lead to equity. Equitable access is a necessary condition for health equity. It's also thinking about the way that, the time in which I grew up. And I grew up in a time where all of our American history textbooks talk about the great melting pot, and as opposed to the great salad bowl. And the aspiration was to be part of a great melting pot. But I have to say, as the years have gone on, I love the salad bowl, because I love all of the different parts of my personal identity and the cultural identity and the identity of people that I know and think about. And my family is a great big salad bowl. So culturally, as many of you know, my father was, I'm a daughter of an immigrant. My father emigrated from Iran. His family was Muslim. My mother's parents were Russian Jewish and German Protestant. And I believe that all of those different aspects of my identity and the identity of everybody that I know contributes to our ability to really think about each other and to be part of a we, not just part of these very siloed groups and siloed approach. So one of the things that we did with this Innovation Summit in particular is that we had we worked together with our team, patient advocacy, education, and engagement team. And I really wanted to thank the people on our team, Ashley Freeman, Caitlin Donovan, Emily Brown, Jamie Trotter, and Tracy Hollis. But this year we had we always consult with people, but this year, in order to build this summit, we really focused on bringing in and talking to in a slightly more formal way, a group of informal advisors. So I'd like to, and they helped us really pull this, they helped us really define this, innovation summit, because it was really important to us that we looked at what holding the line meant in defending health equity from multiple different perspectives without the hubris or the certainty that we knew all those different perspectives. We brought in a lot of different perspectives in order to develop this. So I wanted to acknowledge and thank our informal formal advisors, Andrea Jenkins, Arthur Pope, Beverly Rogers, Denise St. John, Kelly Rand, Reggie Tucker Seeley, Robert Rock, and Tara Montgomery. And you'll hear from some of them throughout the day. So I wanted, before I introduce Ms. Echohawk, I wanted to just quickly go through the agenda and thank you all for being here, because this is a conversation. This is something that we and this is the beginning. This is an ongoing conversation. This builds on the work that we all have been doing separately and together for many, many years. So the agenda, we will start, and I will introduce her with our keynote address by Abigail Echohawk, and also a Q&A with my colleague Jamie Trotter. We're going to have a story excerpt, and we'll have 3 different story excerpts, and they're all from actually our podcast series, Advocates in Action. The first one is Adrienne Moore. It's called Dying to be Heard, and she's the president of Endometrial Cancer Action Network for African Americans. We then go into a panel about building an inclusive and diverse healthcare workforce. And in this panel, often when people say inclusive and diverse, they think about it from the perspective only of race, ethnicity. And we're looking at it from multiple perspectives, including everybody who's part of our healthcare workforce, community health workers, home health aides, and also a medical clinical perspective. And that'll be moderated by my colleague Ashley Freeman. We have a story excerpt by Arthur Pope, in which he talks about how identity helps shape our healthcare experience. Then we have a panel about how funding changes impact research and social needs delivery. And I know that's been a really important topic for so many of us as we navigate the current sociopolitical climate. We have a story excerpt by Philip Liberti about Beyond the Zero-Sum Myth, how health equity benefits everyone. And I think you'll hear a lot of that theme throughout the course of the day. And we have a really thought-provoking fireside chat between Shoma Sava and Tara Montgomery called about choosing courage, and how Shoma, particularly in her work with We in the World, the organization she leads, has taken how they have chosen courage and the ways that they have chosen courage. And then Reggie Tucker Seeley and I will finish off with a call to action and closing remarks. We always want to leave with a call to action. And while we are certainly going to acknowledge what the threats are and what is trying to stand in the way of achieving health equity, we also want to focus on and highlight some of the things that people have done that are in ways that they can combat these threats to health equity, whether it's in a larger group or individually. So you also see that woven throughout. It's really important to acknowledge what the threats are, but it's also equally important for us to help people understand how to address these threats and some barriers that we can pull down.